Hello class, welcome to today's video. We're going over chapter 13, the cardiovascular system. Learning objectives for this chapter are to discuss the location, size, and position of the heart in the thoracic cavity, identify and discuss the heart chambers, valves, and sounds, trace blood through the heart and compare the functions of the heart chambers on the right and left sides, list the anatomical components of the heart conduction system and discuss the features of a typical electrocardiogram known as an ECG or an EKG. Define cardiac output and discuss the factors that influence cardiac output. Explain the relationship between blood vessel structure and function. Trace the path of blood through the systemic, pulmonary, hepatic portal, and fetal circulations. Identify and discuss the primary factors involved in the generation and regulation of blood pressure and explain the relationships between these factors. So as we begin, the heart is a triangular organ located in the mediastinum with, very important, 2/3 of the mass to the left of the body, midline, and 1/3 to the right. The apex is on the diaphragm, and the shape and size is that of your closed fist. The heart is located between the lungs and the lower portion of the mediastinum. Again, the apex or the blunt point of the lower edge of the heart lies on the diaphragm. We listen to the apical pulse or the apical beat, very important here, located over the space between the fifth and sixth ribs on a line even with the midpoint of the left clavicle. And there's a lot of reasons why we have to listen to the apical pulse. We listen to it with a stethoscope for 1 full minute, and you'll learn about that more in health assessment in the future. Now, cardiopulmonary resuscitation, or CPR, the heart lies between the sternum in front and the bodies of the thoracic vertebrae behind. Rhythmic compression of the heart between the sternum and the vertebrae can maintain blood flow during cardiac arrest. If combined with artificial respiration procedure, it can be life-saving. Now, this is an image of the heart. So as you can see, there's a lot of structures you're going to have to be paying attention to. Again, I'm not going to have you label the image, but you need to know where things are located. So in this, you can see the red of the top is the arch of the aorta. Remember, that goes all the way down through the middle of the abdomen and then bifurcates or branches out into the iliac arteries that turn into the femoral arteries that go down the legs. You can see the right pulmonary artery, the left pulmonary artery, pulmonary trunk. You see where the superior vena cava that comes off the top of the heart and the superior vena cava that goes off the bottom. Those are purples. Those are veins, right? Deoxygenated blood. You can see the outside of the right and left atrium and the outside of the right and left ventricle, and you see a lot of blood flow here. So you see all of those coronary arteries that's on top of that little yellow fatty tissue, and these are what gets blocked in a myocardial infarction, also known as a heart attack. So the functional anatomy of the heart chambers, we have 2 upper chambers called atria. The atria are the receiving chambers. You have a right and left atria. Remember, atria are the receiving chambers. Then you have the lower chambers called the ventricles. These are the discharging chambers, and you have a right and left ventricle. Wall of each heart chamber is composed of cardiac muscle tissue called myocardium. The endocardium is the smooth lining of the heart chambers on the inside, and inflammation of the endocardium is called endocarditis. Now, the pericardium, or the pericardial sac, this is a 2-layered fibrous sac with a lubricated space between the 2 layers. The inner layer is called the visceral pericardium or the epicardium. The outer layer is called the parietal pericardium. So here you can see the internal image of the heart. And if you see this little cut up on the left, you can see where the endocardium's the inside of the heart. Then highlighted in pink is the myocardium. Then you can see the visceral pericardium or the epicardium, and then the outside, which is the parietal pericardium. Now on the right hand side, you can see your right atrium, left atrium. On the right side, you can see the tricuspid valve. On the left side, you see the bicuspid valve. So something I always remember is right atrium, right tri, left bi. That helps me remember which atrioventricular valves go with which side of the heart from the atrium. Then they go down into the right ventricle and left ventricle, and you see in the middle there's this interventricular septum. And this gives a good little broad overview of the internal chambers of the heart and the layers. So right tri, left bi. Now the heart action. So contraction of the heart is called systole. Contraction of the heart is systole. Relaxation is diastole. The atria contract first, called atrial systole, which forces blood into the ventricles. The atria are now in diastole or rest. Once filled, the ventricles contract, called ventricular systole, which forces blood out of the heart and either into the pulmonary circulation or into the systemic, which is the rest of the body. Now the ventricles are in diastole, and it restarts all over again. The heart valves keep blood flowing through the heart and prevent backflow normally. They consist of 2 atrioventricular valves and 2 semilunar valves. So first you have the left AV or bicuspid mitral valve. And this is at the opening of the left atrium into the ventricle. So you need to know bicuspid or mitral valve, left. Then you have the right AV valve called the tricuspid at the opening of the right atrium into the ventricle. The pulmonary semilunar valve is at the beginning of the pulmonary artery, and the aortic semilunar valve is at the beginning of the aorta. Apologize there. So, in the blue, during atrial systole or contraction, cardiac muscle in the atrial wall contracts, forcing blood through the atrioventricular valves and into the ventricles. B, in green, during ventricular systole that follows, the AV valves close and the blood is forced out of the ventricles through the semilunar valves into the arteries. And in this image, remember again, you need to know, which AV valves are left side, right side versus semilunar valves on the left side and the right side. So make sure you're paying attention to your images. Now, there are 2 distinct heart sounds in every heartbeat or cycle, described as a lub, a dub. The first sound, lub, is caused by the vibration and closure of the AV valves during contraction of the ventricles. The second sound, dub, is caused by closure of the semilunar valves during relaxation of the ventricles. Important to know. Now, blood flow through the heart. So basically the heart acts as 2 separate pumps. The right atrium and ventricle perform different functions from the left atrium and ventricle. Even though they pump together, the atrium both pump at the same time, and then the ventricles both pump at the same time. They're going to different places. So, the sequence of blood flow. So, venous, which is oxygen poor, venous, think blue, oxygen poor, blood enters the right atrium through the superior and inferior vena cava. Now, you must know this whole page here. It then passes from the right atrium through the tricuspid valve to the right ventricle. From the right ventricle, it passes through the pulmonary semilunar valve to the pulmonary artery to the lungs. Blood moves from the lungs to the left atrium, passing through the bicuspid or mitral valve to the left ventricle. Blood in the left ventricle is then pumped through the aortic semilunar valve and into the aorta and distributed to the body as a whole. So the left ventricle, it goes out the aortic semilunar valve into systemic circulation. The right ventricle sends it into pulmonary circulation into the lungs. This gives a good idea of blood flow. So in the pulmonary circulatory route, which is in blue, blood is pumped from the right side of the heart to the gas exchange tissues of the lungs. In systemic circulation, which you can see here in yellow, blood is pumped from the left side of the heart to all other tissues of the body. So blood, which supplies oxygen and nutrients to the myocardium of the heart, flows through the right and left coronary arteries. This is called coronary circulation. Blockage of blood flow through the coronary arteries is sometimes called an myocardial infarction, MI, also known as a heart attack. Angina pectoris is chest pain caused by inadequate oxygen to the heart. Coronary bypass surgery. This is where veins from other parts of the body are used to bypass blockages in the coronary arteries. Angioplasty is a procedure in which a device is inserted into a blood vessel to force open a channel for blood flow through a blocked artery. So these are all important terms. Now let's look at these coronary arteries a little bit. So again, I don't expect you to memorize all of them. I do want to point out you have the right side, the RCA, right coronary artery, marginal artery, all of that. Then you see the pulmonary trunk on the right side of the image here, the left coronary artery, circumflex artery, anterior intraventricular artery. So these are, the left side is usually associated with the widowmaker, the big heart attack, the sudden cardiac arrest. It's not important for you to know that now. You will learn that more in nursing courses. But again, you have to have a little idea of what the coronary arteries are that wrap around the heart. So basically in ventricular contraction, you can see in green the aortic valve opens, blood flow goes out. Ventricular relaxation, the aortic valve closes, and you can see where it goes through into, when it closes, it spurts blood flow around the heart. Coronary bypass. So here, this shows on the left is a single bypass. So basically what they've done is they have taken veins from the leg or somewhere else, and they sew them in where they need, right? So you can see here where the left internal, so mammary, this came from mammary artery in the breast then, and you can see where it's grafted all the way down past that obstruction in yellow. Now on the right side, you see 3 areas of yellow. This is a triple bypass, and you can see the lavender where they've harvested grafts, vein grafts from the legs to go around all 3 of these blockages to perfuse good blood flow into the heart so it doesn't die. Because without oxygen, your heart and any tissue in your body will start to die. Now, The cardiac cycle, the heartbeat is regular and rhythmic. Each complete beat is called a cardiac cycle. The average is about 72 beats per minute, but in nursing school, anything between 60 and 100 beats per minute is normal. Each cycle is about 0.8 seconds long and subdivided into systole, which is the contraction phase, and diastole, which is the relaxation phase. Stroke volume is the volume of blood ejected from one ventricle with each beat. Cardiac output refers to the amount of blood that one ventricle can pump each minute. The average is about 5 liters per minute at rest. So cardiac output is very important to remember. Now let's move into the electrical activity of the heart. There are intercalated discs that are electrical connectors that join all the cardiac muscle fibers in a region together so they receive their electrical impulse, thus contract at about the same time. Specialized conduction system structures generate and transmit the electrical impulses that result in contraction of the heart. The first one I want to talk about is the SA node, the sinoatrial node. This is the pacemaker of the heart. It is located in the wall of the right atrium near the opening of the superior vena cava. Then we have lower down the atrioventricular, the AV node. This is located in the right atrium along the lower part of the interatrial septum. So then it goes down into the AV bundle, or the bundle of His, located in the septum of the ventricle, into little bitty tiny Purkinje fibers located in the walls of the ventricle. So basically, without looking at the heart, it goes from the SA node, which is the pacemaker, down both sides in the middle, down the heart to the AV node. The electrical signal keeps going through the bundle of His and down into the Purkinje fibers in the ventricles. And that is shown here on the left-hand side. So this kind of gives you an idea of what's going on. So the SA node, the pacemaker of the heart, the electrical signal comes from here, goes to the left and right atriums, and down in through the AV node to the bundle of His that goes down into these Purkinje fibers, which then stimulate the right and left ventricles. So that gives us a good leeway into electrocardiography, ECG, also known as EKG. The tiny electrical impulses traveling through the heart's conduction system can be picked up on the surface of the body and transformed into visible tracings by a machine called an electrocardiograph. The visible tracing of these electrical signals is called the electrocardiogram, or the ECG, also known as the EKG. Now, the normal ECG has 3 disflections or waves, and you have to know these. The first one, if you look to the left at my image, you'll see like there's a little lump in that first little square, the little black. That would be like the P wave. This is associated with depolarization of the atria. Then it goes into where you see that big, like, kind of jump up and down. This is the QRS complex. It is associated with depolarization of the ventricles. Then it goes into a little line, and then it kind of dips. That is the T wave. That is associated with repolarization of the ventricles. So here again, this is the breakdown of what you're going to see of one heartbeat on an EKG. So an EKG is going to be showing a whole bunch of these in a row. But let's break it down to what's happening here. So number one, this is where the heart wall is completely relaxed. There's no change in electrical activity, so it's just a straight little line. Then there's a little jump up. That is the P wave. The P wave occurs as the SA node and the atrial walls depolarize. Then it goes where the P wave comes down and there's a little tiny straight line again. This is where the atrial walls are completely depolarized and thus no change is recorded in the EKG. Then we have our QRS complex shown here. So Q at the top would be R down to the S, and it goes really low and then jumps back to the normal line. The QRS complex occurs as the atria repolarize and the ventricle walls depolarize. Now, the atrial walls are now completely repolarized. The ventricle walls are now completely depolarized. Thus, there's no change. So you see a little tiny flat area of the blue line. Then we see the little peak of the T wave. This appears on the ECG as the ventricular walls repolarize. And then once the ventricles are completely repolarized, we're back at the baseline, essentially back to where we began at that straight line. So a little straight line, P wave, QRS complex, back up, straight little line, T wave, and then flat line, and then P wave again. It's vital that you understand these. Now moving on, let's talk a little bit more about cardiac output. Cardiac output is the volume of blood pumped by one ventricle per minute. It averages about 5 liters in a normal resting adult, and it is determined by the heart rate and the stroke volume. Moving on, let's talk about arteries, veins, and capillaries. So arteries carry blood away from the heart and toward the capillaries. Veins carry blood toward the heart and away from the capillaries. And the capillaries carry blood from the arterioles to the venules. Now, this is the typical blood vessels throughout the body. It's a little different in that pulmonary circulation that we talked about earlier. Right now, we're just talking about our normal arteries and veins and capillaries throughout our body, not necessarily in the lungs. So that's a little different. But just remember, arteries away from the heart, veins toward the heart, and capillaries carry blood from arterioles to the venules. Now you have to know the 3 layers of blood vessels. The outer layer is called the tunica externa, external, right? Thin layer of fibrous elastic connective tissue. The middle layer of vessels is the tunica media. This is a smooth muscle. It is much thicker. So this middle layer is much thicker in arteries than veins because the thicker muscle in the artery helps resist the high pressure generated by the ventricular systole. Now the inner layer is the tunica intima, inner. And this is a single layer of squamous epithelial cells that lines the inner surface of the entire cardiovascular system. So artery and vein, on the left side is red artery, the right side is blue vein. Now I want you to notice the inside is the tunica intima or the endothelium. Then you got the middle, which is tunica media. This is that it's thicker in arteries, thinner in veins. Then the outside is the tunica externa. This is that connective tissue. It's thinner in arteries and thicker in veins. Now I want you to notice something here. On the artery, you see this elastic tissue, right? Again, the arteries have to resist the pressure coming out of the heart. Now, I notice a difference on the blue, on the vein. You're going to notice a valve. Veins have valves. Arteries do not have valves. Veins have valves because it has to take, for instance, the blood from our feet and our hands and pump it up towards the heart, right? To start the cycle all over again. Well, in order to do that, it has to have these valves that prevent it from going back down. Otherwise, we'd be constantly losing blood and swelling down in our feet all the time, every day. So it has to have these valves. So arteries and arterioles function. This is distribution of nutrients, gases, and so on with the movement of blood under high pressure. It assists in maintaining the arterial blood pressure. It distributes blood from the heart to capillaries in all parts of the body. Capillaries serve as exchange vessels for nutrient waste and fluids. The two forces influencing capillary exchange are osmosis and filtration, and they are opposing forces. They are opposite forces. In veins and venules, these is where they collect blood for return to the heart. These are low pressure vessels, and the external pressure applied to the veins can promote the return of blood to the heart due to the presence of one-way valves. This is also helped by, like, when we walk or when we move our arms, the muscles help to contract. That also helps to push the blood back up and in towards the heart. This shows you the principal arteries of the body. And you will be memorizing a lot of the pulse points, arteries in the body later at a later class. So you can see there's a lot of arteries. Now, if someone gets cut on an artery, they are just going to gush. They're just going to shoot. They're going to pump out. Every heartbeat's going to pump out a gush of blood out because it's in the artery, it's heart, it's really, really pressurized in there. If you get cut on a vein, you can still bleed out and hemorrhage just like an artery, but it takes a lot longer because you've got those pumps and it's not under as much high pressure as an artery is. This shows the veins. So there's just as many, you can see back here arteries, and then you see all the veins. There's a lot of veins going on. Now, of these veins, we use a lot in the arm. You'll learn different veins in the arm for doing IVs, things like that in the future. So now let's talk about routes of circulation. I mentioned this earlier. I talked about blood circulation, systemic circulation, pulmonic circulation. So let's look at this. Systemic and pulmonary routes of circulation. Blood circulation refers to the flow of blood through all vessels, which are arranged to form a complete circuit or circular pattern within the body. Systemic circulation begins at the left ventricle when blood is pumped into the aorta. Carries blood throughout the body, and the path goes from left ventricle through the aorta, through smaller arteries, arterioles, capillaries, venules, then to the vena cava, back to the right atrium. Know that. Now, pulmonary circulation. This carries blood to and from the lungs. Arteries deliver deoxygenated blood to the lungs for gas exchange. So this is where I told you this is very specific only to pulmonary circulation. At any other time, deoxygenated blood or blood that is poorly oxygenated is in the veins, right? But in this case, coming off the heart and going into the lungs, the arteries will deliver deoxygenated blood to the lungs for gas exchange, and the veins will deliver oxygenated blood back in. So the path goes from the right ventricle through the pulmonary arteries to the lungs, and the veins bring oxygenated blood back to the left atrium. This means that pulmonary veins that empty into the left atrium of the heart are the last blood vessels of pulmonary circulation. It's very closed, heart, lungs, back to heart. This shows a diagram, but you feel free to study this. However, I've already summarized this for you. Now let's talk about hepatic portal circulation. Anytime you see hepatic, we're talking about the liver. So, unique blood route through the liver. So we have the hepatic portal vein that exists between two capillary beds. This assists with the homeostasis of blood glucose levels. Remember, I told you excess blood glucose goes to the liver, gets stored as glycogen. It gets in there through the hepatic portal vein. So this shows you how much circulation is up in that liver. The liver likes a lot of blood, just like the spleen. We're going to talk about that more in the future too, but the liver has a lot of blood supply. If the liver gets lacerated or cut, it will bleed and bleed and bleed and bleed and bleed. There's a lot of hepatic veins, as you can see, going up into this liver. You can see the big hepatic portal vein, which is the big one that goes up and branches off into hepatic veins throughout the liver. You can also see we got a whole lot of mesenteric and a lot of veins going into the intestines as well, and into a little more into the spleen and stomach. But that liver has a lot of what we call portal circulation, a lot of blood flow. Now, when we say fetal circulation, we're talking about circulation that happens to the fetus before birth. Modifications required for the fetus to efficiently secure oxygen and nutrients from the maternal blood. There are unique structures that include the placenta, umbilical arteries and vein, ductus venosus, ductus arteriosus, and the foramen ovale. So, I have highlighted some very, very important things on this image that you must know. So again, it goes from where we've got substances are exchanged with the maternal circulation through the placenta that's attached to baby. The placenta goes through, it has the 2 arteries and the 1 vein. The blood then enters the liver and connects to the inferior vena cava by way of what's called the ductus venosus. Very important. You can see that in red. So then the blood might bypass the pulmonary loop by moving from the right atrium through the foramen ovale, a hole in the heart, into the left atrium of the baby. This is because the lungs are closed. They're in water, right? They're in the fluid. So they can't do gas exchange by breathing. So then, remember that right atrium through the hole in the heart called the foramen ovale to the left atrium. Blood may also bypass the pulmonary loop at the pulmonary trunk through the ductus arteriosus into the aorta. Blood is then returned to placenta through the umbilical arteries, which branch from the internal iliac arteries. So again, ductus venosus, foramen ovale, ductus arteriosus. You must know what these do in fetal circulation. Now let's talk about the hemodynamics of the cardiovascular system. So first of all, let's define blood pressure. This is the push or force of blood into the blood vessels. It is highest in arteries and lowest in veins. Blood pressure gradient causes blood to circulate. Liquids can flow only from the area where pressure is higher to where the pressure is lower. So this is really, really complicated. So at the top, I did a little summary for you up here. Blood flows down a blood pressure hill from arteries where blood pressure is the highest into arterioles where it is somewhat lower, into capillaries where it's even lower, and so on, right? Area of higher concentration to lowest. You don't have to know this calculation of flow rate or anything like that. Now, factors that influence the blood pressure. Blood volume, right? We have to have enough blood in our body. The larger the volume, the more pressure is exerted on the vessel walls. Strength of the heart contractions affect the cardiac output. So a stronger heartbeat increases pressure. A weaker heartbeat decreases blood pressure. Heart rate is increased with increased increased rate increases the pressure, and decreased rate decreases the pressure. Blood viscosity is the thickness of the blood, and less than normal viscosity decreases pressure. More than normal viscosity increases pressure. Then we have resistance to blood flow. This is called peripheral resistance, and this is what happens further away from the heart, down in our lower legs, feet, even at the hands can be affected. These are affected by many factors, including the vasomotor mechanism, which is basically the vessel muscle contraction or relaxation part. So here you can kind of get an image of the vasomotor mechanism. So here you see the smooth muscle relaxation. There, it's big and open. There's decreased resistance. It's nice and relaxed, so it's dilated, right? Then we have the normal resting tone, which is in the middle. Now, if it gets constriction, right, smooth muscle contraction that constricts, it actually increases the resistance. So there's more pressure that it's having to push against. And over time, this increased resistance, this constriction, can start to wear the system out and just cause more and more high blood pressures. Now, fluctuations in arterial blood pressure. First of all, the blood pressure varies within a normal range. It doesn't say constant or the same every second of the day. Normal average arterial blood pressure, which is what we take when we take our blood pressure, is 120/80. Now there's something called a central venous blood pressure. This is the venous blood pressure within the right atrium. The venous return of blood to the heart depends on 5 mechanisms. First of all, the heart has to be beating strongly. There has to be adequate arterial blood pressure. The valves in the vein have to be working well. The pumping action of the skeletal muscles have to be working, so you've got to be moving your extremities. And changing pressures in the chest cavity caused by breathing. So these are all factors that deal with the basics of venous blood pressure. Now let's talk about pulse. The definition of pulse is alternate expansion and recoil of the blood vessel wall. There are 9 major pulse points in the body, named after arteries over which they are felt. So pulse points, in order to get a pulse, you have to feel over an artery and count for 1 full minute. Here are the pulse points that you will have to know in your future classes. You've got the major one at the top is your carotid. You can see the temporal up there on the head. You can rub this sometimes when you have a headache, but the major one is carotid, right? That's nice and big. It's on either side of the neck. You do not want to ever palpate or touch both sides of the carotid arteries in the neck. You can actually make someone pass out. Then go down, you have the axillary artery, the brachial artery, and the radial artery on the arm. The radial artery is the radius side, radius bone, remember, radial bone. And that is most common where we get a lot of blood pressures. Then, as you can see in the middle, you've got the aorta coming down from the heart that goes into the femoral artery, which is right in the groin area on either side. Then behind the knee is called popliteal. And then going down behind the ankle is posterior tibial. And then on top of the foot is the dorsalis pedis. And these are the most common pulse points that we use in nursing and that you will need to know in future nursing classes. So that ends the cardiovascular system. I recommend that you, just as any of these videos, that you rewatch, pause, take notes as you need to, and just keep on studying. And you can get this done. So that is all for now. I will catch you in the next video.